is that you may not know what it is. You may not know if somebody has an underlying health problem from taking that. So it has a lot to do with availability and that false belief that they're not dangerous because they come from a doctor. Well, they may come from a doctor, but they come from a doctor prescribed to a specific person for a specific reason. And when you
taken in an appropriate
in an
dosage.
appropriate way, and when you take it outside of that, that's where you enter abuse. And when you mix other drugs, including alcohol, with that mix, that's when it becomes exceptionally dangerous.
And they're so small, you don't realize the danger of them. Like I show, prescription for danger. They're so small, you know. You don't really realize what it's going to do to you.
There's a new medication, well, not really new, but 2 years or so, that more and more powerful narcotics are being developed for patients who have cancer or life-threatening pain in hospitals. But those drugs make it out onto the street through prescriptions. And a teenager who's never taken an opiate before gets their first dose, and that could result in an overdose death.
Right. What is doctor shopping? Doctor shopping. I hear that a lot on TV.
That's actually not the majority of patients, but a fraction of patients actually go to multiple doctors and get prescriptions from each of them, so that no one doctor would be aware that they're getting all of those opiate prescriptions or tranquilizers in one place. And also, I think patients know which doctors have a reputation to give out medications more readily, and those would be the targets.
And Jim, there's a new program that the federal government is putting out that over 30 states now have. It's called prescription drug monitoring, where there will be, where if Dr. Hess is prescribing a drug, he will be able to check if they're getting medication from other places. Pharmacies will be able to check. There's a big push federally to educate the community, parents, doctors. There's a big push for doctors to get continuing education about addiction. There's a big push to monitor, to educate, to increase enforcement, and also to properly dispose of medications, which we do here in our county. We have the medication take-back days through our communities, that care coalitions twice a year, where people can bring back their medicine. And I believe each time we've done that, we have gotten 15% of medications that are narcotics. So we're doing two things. We're protecting our water supply, but we're protecting our youth and community from the diversion of drugs.
Jim, the other thing about the access to it is, the internet is a wonderful tool if used appropriately, but you can buy medications on the internet. And some of the questions they ask you, do you have a prescription? Yes, but they don't verify that you have a prescription. And the issue sometimes could be quality control. You're not getting your internet pharmaceuticals from a known manufacturer, and it may be coming from outside of the country, so you don't know what some of the additives are in there. And I want satisfaction now. We're not worried about long-term concerns. There could be lead fillers in pills, which is not healthy for you. And so I think the access is really, really easy in the United States.
And I also think that a lot of people don't look to the future and try to think about also the legal ramifications, the legal consequences of these pills that are being misused and passed around. And someone, I think Doreen, you had spoken to the DA's office about some of that, right?
Yes, I spoke to our local district attorney's office, and people think that it's different than heroin or different than cocaine. If you get caught selling prescription drugs, you can face up to 9 years in state prison. And the three of us are on our local Putnam County treatment court team, and we have a number of young people under the age of 25 who are facing prison terms from anywhere from 9 years to 27 years. If they don't get their treatment and they don't stay out of trouble, they're facing that amount of time in state prison, and they're in their 20s. So it is treated the same as cocaine and heroin if you choose to sell it. And she told me an interesting thing. They arrested someone that, they had like $250 from selling pills. Pills are expensive on the street, but the cost to you when you get arrested is the loss of your freedom, thousands of dollars for attorneys, how it impacts you and your family and your community, and can in fact change your life, because it is possible to get a job with a felony, but it's decreases over time. Look at our unemployment rate. So people don't think of those, as Nora said, the long-term legal consequences as well as the health consequences that we've spoken
Jim,
about.
there's 2 points about that that I think are important, and one point I'd ask the providers to talk about, but one is there's collateral damage with prescription medication abuse, and that is you're going to see, if we haven't seen already, a rise in burglaries. We're going to see a rise in other type of criminal activities because it costs money. And most people who have really horrible addictions don't really have great jobs, and so they're out robbing people's houses, and we've seen that increase in
There is an increase in that. There's an increase in robberies due to fueling heroin addiction, and heroin addiction is very often the end point of pill dependence, because people will go to the dealer and the dealer will say, I don't have any more pills, here, try this. The heroin's cheaper. They go to the heroin and they start robbing houses, and there has been an increase in home robberies in our county, as well as a 15% increase in driving while ability impaired, as Dr. had said earlier.
And that was my point about I was going to go into this heroin addiction, and maybe Dr. Hess can briefly talk about that. But that's sort of a dangerous step.
It's almost a natural one, unfortunately, because as the person's tolerance builds up to say the OxyContin, some of the kids will pay as much as $20 or $40 depending on the size of the OxyContin, and yet a bag of heroin is $10. So it's almost a natural gateway drug from a legal prescription that they obtained illegally, but switching to heroin. And you know, for the patients that we admit in Arms Acres, most of them would not have ever believed that within a year or two of starting OxyContin that they could wind up doing heroin. And then the beginning points of the heroin dependence are usually sniffing it, but then that quickly changes to injecting it to get, again, a stronger effect.
So I want to ask you, like, now, when it comes to Arms Acres, what happens there for people when they go there? Maybe you could say something. What kind of help do they get there when they go there, Dr.?
Well, my role is I can help people identify the problem and the level of care that they need. It could maybe outpatient services, or somebody might need a detox, or they might need the rehab services. And Dr. Hess is our medical director, and he can speak to, some other things that.
Yeah, the opiate detoxes have increased dramatically in the last 4 or 5 years, and now routinely we have between 3 or 4 adolescent patients from 15 and up detoxing from heroin or prescription opiate pills. And then the other group is adults, as we find a lot of the patients who before were just coming in for alcohol detox are now getting detox from 2 or 3 other medications that they were dependent on, and had kind of slid into that from their original alcohol problem.
What happens with you, Doreen, over there?
Well,
what do you
Jim,
offer?
we provide outpatient services, which we can provide assessment, individual, group, family counseling, and it's also important to mention the very addiction medicine, whereby medications are used to treat opiate addiction and alcohol addictions. Behavioral interventions and addiction medicine can help people as well. There's also self-help options. So we try to use the combination of services in the community, such as self-help, outpatient, inpatient, and we all work very closely together to help people find the correct treatment that will work for them.
Is it successful, helping alcoholics, or is it harder to work with people like this, with this type of habit?
I think, addiction is a brain disease, so part of that illness can be relapsing, and you don't know when someone is going to get it, so to speak. So, our belief is that people can and do recover, and that treatment works. So there are many people who do succeed in their recovery, regardless of their drug of choice.
Any of us here on the panel can help someone identify if it's a drug problem versus an addiction, and there is a difference. And I know we don't have another half hour to discuss that, but they can call any of us, and we'd be more than happy.
Very good, very good. So I just basically want to thank you for coming. We have to end the show now. It's about 1 minute left. So thank you so much for coming. Really appreciate you. You did a great deal, I think, for the community here tonight. Thank you very much.
Thank you.
Thank you.
Thank you very much for watching. Bye.